Okay, I think I can get started there. Good evening, everyone. My name is Erin, and I am one of the marketing coordinators at BCIT for all of the health sciences programs. But thank you for joining us tonight for the Bachelor of Science in Nursing information session. So we're going to talk about the BSN program at BCIT and give you a lot of information about the program itself, the career, and application details. So the majority of our program tonight, the first part will be done by Jill Kerrigan, our program head, and then we will have admissions and application details by our program advisor, Babina. I would just like to share that the British Columbia Institute of Technology does acknowledge that our campuses are located on the unceded traditional territories of the Coast Salish nations of the Squamish, Tsleil-Waututh, and Musqueam. As we're all on Zoom tonight, we are obviously coming from a number of other territories as well, maybe at work, at school, or out somewhere. So I want to acknowledge that I'm currently coming from the Quake-Whitlam territory, and you are welcome to take a moment to yourself and think about what territory you're coming from as well. So moving forward, our agenda this evening, as I mentioned, welcome and introductions. That's the part I'm doing right now. Presentation, program overview, program advising, information, and then at the end we'll have some Q&A. So as you type those questions into the Q&A function, we will try to answer some of them as we go along. We have a number of BCIT people on the call tonight as panelists, and so they will try and answer some of your questions. Anything we don't get to, maybe we'll answer some of those out loud at the end. So we'll figure that out as we go. So moving along, I'm going to actually share a video first.
I'm back to check on your blood glucose levels. Being in the clinical setting really puts my skills into practice. I love that I get to apply what I learned right into the clinical setting with actual patients. Clinical experience really consolidates what we learn in terms of knowledge in our theory courses. So I chose BCIT nursing because of the reputation it's built within the healthcare practice. And I wanted to show you about my patient. Right? I love that I get to collaborate with my student nurses and really get the hands-on experience that you normally wouldn't get at other institutions.
Okay, very good. Now make sure that you
The BCIT BSN program is a 3-year program where we give students the training and experience to practice as registered nurses across BC.
the patient's pupils and look quite...
From the very beginning of our program, students will get hands-on experience in the lab and in the simulation room.
Excellent, good placement.
This is really beneficial for students as it provides students with a safe environment to practice newly learned skills before applying it to patients in the practice setting. We are very excited here at BCIT to offer a brand new curriculum that was written in-house where students learn concepts that they will be able to apply to different contexts. Rather than learning just about diabetes, they learn about the concepts around diabetes and are able to apply it.
You can see there that it's...
When our students graduate, they are 100% prepared to practice in acute care settings, in clinics, and other healthcare settings across the province. Our grads are highly sought after by our health authority partners. There is ample opportunity for them to explore whatever avenue they choose.
The best thing about my clinical experience so far is how approachable and how really caring my instructors are. They really make sure that not only are we comfortable in what we're doing, but that the patients are safe under our care as well.
Okay, I hope that video helped you understand a bit about our program, but we're definitely going to go into more depth here. Introducing Jill, our program head. Jill, should we start with some of those polls before you go ahead?
Sure, let's do the polls first.
Okay, so we're going to post up some polls on the screen here. There's going to be 2 questions. So the first question, and then if you scroll down, there's a second question. So we're hoping all of you can just click on the answer that you think is most correct on both of those, and then we'll see how close we get to the right answer. Okay, I think we're going to end it there, and I'm going to share the results on screen, and Jill can tell us how close we are to correct.
Okay, thanks, Erin. For the first question, I've written down the last numbers was 34,000. So I think that's the correct answer. So 31% of you got that one correct. How many nurses are there in the province of BC? And the next question, you're right. BCIT does have the largest nursing school in the province. So well done.
Okay, thank you, everyone. And on to you, Jill.
Okay, so welcome everyone. As Erin said, I'm one of the program heads in the BSN program, and I'm super excited to be talking to you tonight. So thank you for joining, and it's great to have so many of you interested in the nursing profession because I think it's a great profession, and I hope that you decide that after this as well. So we can go to the next slide, Erin. Okay, so what is the Bachelor of Science in Nursing program? So to start with, here are some quick facts about BCIT's Bachelor of Science in Nursing program. It is a 3-year program. There's 3 terms in each year for a total of 9 terms. You do get most of July and all of August off, and you get a majority of December off as well. Because our terms are 12 weeks in length, our program is only offered on a full-time basis. Erin, I think you can go to the next slide too. And there's a mix of clinical, lab, simulation, and theory classes in every term. So unlike some other programs, you do start clinical right in term 1 at BCIT. We offer a variety of clinical experiences, anywhere from community to hospital placements. And each term, the clinical course, all your courses do progress in nature. So you're starting to, in clinical, do more and more skills and more thinking like a nurse as you progress through the program. What's unique about the BCIT program, and you'll hear me say this many times tonight, is that we partner with the specialty programs that are on campus. So BCIT does have the specialty programs. And so within your BSN program, you can take 2 elective courses. So that's really nice because you might pick a specialty that interests you, like pediatrics or nephrology, where you might want to take a little bit more interest in that and end up doing your what we call focus of practice. So your last preceptorship in that specialty area. You do graduate with a bachelor's degree and can begin to work as a nurse as soon as you complete the entrance exam. So BCIT does have a brand new health science center, and in this building we have the largest simulation center in all of Western Canada, so that's very exciting for us. We have rooms that look like hospital rooms. We have high-tech robotic mannequins that have heart rates, they breathe, and they can even speak certain phrases. Students use this simulation space with their instructor to practice clinical scenarios to help them feel more confident before they go into the clinical setting. Because we really are focusing on safety, and we found that that is the safest thing for our students to do, is to be practicing in a simulated environment before going into the hospital setting. So what do our BCIT nursing grads look like? So at the end of the program, this is what we're hoping that our grads will look like. And so this is what we structure our courses so that our grads get there. Professional nursing is a regulated profession. So students are held to a certain standard. They're expected to act in a professional manner. So some of these things are attending class, being a representative of the profession. Leader, our grads can take charge of situations in order to plan care with the client. Advocate, our grads advocate for clients to ensure they're receiving quality care. Collaborator, they can work with many members of the healthcare team in a respectful manner. And that's why we have quite a bit of group work in our program, and we have communication classes. Global citizen, our grads advocate for change to address issues of social justice and healthcare inequity. Lifelong learner, so grads are committed to lifelong learning, really important in nursing as things constantly change and you're having to update your practice through some self-directed learning. And then lastly, communicator. So we teach our grads to communicate with empathy, compassion. That's the way to build those relationships with our clients. and also to communicate in an assertive manner so that they can effectively communicate with the healthcare team. So we often get asked what types of students succeed in the BSN program. And we found that our this is based on research as well, students who are able to manage stress and anxiety effectively, they have resilience to overcome obstacles. Resilience is actually a really big piece of succeeding as a nurse because just having that flexibility to change and having a growth mindset. Students should be effective communicators, so fluent in written and spoken English, and that's a safety piece with nursing. You need to be able to communicate with the healthcare team and with the clients and their families. If you have related work or volunteer experience, especially in the hospital, home care, maybe lifeguarding, leadership in sports, it's not mandatory, but it is really helpful, and we found that it just helps our students take charge of situations when they enter the program. Math and science basics are required. So you don't have to do complex math equations, but nurses do need to use math to administer medication safely. Why become a registered nurse? So if you're still on the fence and you're not sure, is this the program for you or is this the profession for you? It's a career where you're never going to get bored. And that's, for me, that was a big draw as well. You can work in so many different areas, from hospitals, research, community centers, public health, lots of different places that you can work in. And so you'll never be without work either, because there's a lot of career stability. We're always going to need healthcare professionals, so it's a great career to get into for just that lifelong stability, really. People often say they want to be a nurse because they want to impact people's lives in a positive way, to make changes to the way healthcare is delivered, and to advocate for patients. And these are all great reasons to get into nursing and to healthcare in general. And some of the things that a registered nurse does are listed here. So we assess patients, and that means we take their blood pressure, we listen to their heart rate, their lung sounds, look at their skin, assess their overall mental health and well-being. These are only some of the things that we're assessing. Lots of other things are included. And then we take these findings and we analyze them. So this is when we're talking about thinking like a nurse. We're making connections to determine, does this make sense with the overall picture of our patients? And it's a little bit of detective work as well. We figure out what to do about these findings. So we call these interventions, where we might administer medications to help with pain, do a surgical dressing change. We might provide personal care, education to our patients, a whole variety of things. Nurses are focused on the overall health of a patient population, so they can provide education on preventative health, like immunizations. And lastly, nurses provide end-of-life care for patients who are actively dying. And that's another part that's really picking up in the community as well. And I'm often asked, what does a typical day look like for a nurse? And so I've just put this on the slide. And this is for hospital-based nursing. And I know not all nurses work in the hospital, but most nurses that do work in the hospital on a full-time basis are doing shift work, 2 days, 2 nights, and then 4 to 5 days off. So it's a really nice chunk of time that you get off. Shifts are usually from 7 to 7 or 7:30 to 7:30. There are opportunities for part-time work, casual work, or 8 hours. This is just a sample of a 12-hour shift. We start by getting a report on our patients. Like I said, we assess, we look at safety, we set priorities for the day. We are thinking like a nurse, so we're analyzing those findings that we assessed, administer medications, provide treatments, then we reassess our patients and collaborate with the healthcare team, and lastly, documentation. So these are all things that we would do on a daily basis as a nurse. And then just some quick facts. About 55% of nurses in BC do work in the hospital, but like I said, there's other places that nurses work. Community is the next grouping, followed by nurses in long-term care. And just another fact about why it might be a great time to enter the nursing field is BC is short nurses. So a little over 4,200 nurses. We're short. I suspect that number has increased. That was from 2022. So our grads are often getting job offers before they graduate. In terms of the career outlook, nursing is both a challenging and rewarding career. I certainly have no regrets about going into the nursing profession. And with a BSN degree, you can work globally as a nurse. As I said, BCIT, you have a fantastic opportunity to pick specialty courses and start to work in that specialty area. And we have these learning pathways that you follow these learning pathways to get some experience in your chosen specialty. And like I said, there's lots of career growth. Nurses are becoming nurse practitioners and working in clinics and opening up their own clinics. There's also opportunity to get your PhD, master's degree in nursing as well. So what can a nurse do and where do they work? So as I said previously, 55% of our nurses do work in the hospital, whether it be in a medical surgical ward, emergency room, operating room, critical care, maybe pediatrics, maternity. But there's also many other areas that nurses work in, such as community, public health, mental health, and global health. Nurses can be in administration, so leadership positions in the hospital or health authority. They can teach, as I do. They can be involved in research. But again, the nice thing about nursing is you're not going to get bored and you can move throughout these specialties throughout your career. And speaking of specialties, as I said, as a BCIT nursing student, you can graduate with the start of a specialty. So you can get exposure to things like pediatrics, working with kids. Perinatal is caring for women who have or having babies. Neonatal, care of the infants. Nephrology, this is kidney dialysis, kidney transplants. The other ones I think you're probably familiar with already. Emergency critical care is ICU, and high acuity is just a little bit lower than ICU, so patients are not as sick. So lots of different specialties that you can get into. And the last slide. So we have Veronica Ford here today. I'm going to read her testimonial, and then I'm going to ask her what it's like to be a nurse in our program, because she was, we're fortunate that she's joining us tonight. But she gave us this testimonial to use in our info session. And she says, as a nursing student, I've learned so much about what it means to be a professional in a career that focuses on caring for the individual and not the disease. I've learned that if you work hard, you can make it through any challenge you face and ultimately thrive. Remember that you make a difference in someone's life and that you can be the voice that advocates for your patients. So Veronica, if you can unmute.
Yes.
And excellent. Thanks for joining us, Veronica. So do you have anything else to add in terms of what is it like to be a student in the BSN program?
Yes, so currently I'm in my last term. I'm in term 9. I'm a preceptorship student, so I'm doing the 12-hour shifts 4 days a week. And I was thinking about what I wish I knew before going into the program. And I think bridging off of what you were saying about resilience as an important concept, that's something that I've learned throughout my education as a nursing student. And like my testimonial here says, if you work hard, you can do it. And that means being open to asking peers for help, going to open lab, familiarizing yourself with equipment, and being brave enough to tell your instructors, hey, I think I need a little bit more support. Asking for help is not a weakness, but actually is a sign of strength, because it shows that you recognize where your weaker areas are and you actively want to do something about it. So within the BCIT BSN program, you will be getting tools to help you grow as a nurse that will help you continue as a learner. And I guess one of the most humbling things that I learned this term in my preceptorship is that I will not know everything once I graduate. But through the last 3 years of being in the BSN program, I've learned how to critically think and use my education as a strong foundation for my future practice. So I think as a almost graduate, I want to give you guys just some encouragement that yes, this is a very condensed and hard program, but it is very rewarding at the end of the day. So if there's any other questions I can answer, please feel free.
All right, thank you so much, Veronica. I'm going to hand it back to Erin. I think that's the end of my part.
Yeah, I just wanted to say that if you do have questions specifically for Veronica, you can type that into the Q&A and we can see if Veronica can answer it there. And I'm actually going to hand it over to Bhavina, who's going to talk to us about some of the admissions and application and program advising information.
Thank you. So I'll provide you with an overview of the application and admission process. Next slide, please. So here are the application steps. I will go into more detail in later slides on this, but just generally speaking, filling out the online application is relatively straightforward, and the process takes place entirely online. Once the application opens for each cycle, you can log in and review the online application, and you can work on filling it out at your own pace. It does not go to the admissions office until you actually pay the application fee. You have until the deadline to submit your completed application. Regarding the application process, you will first review all entrance requirements and the application processing dates. You need to ensure that you meet all entrance requirements and upgrade if necessary. Ensure that when you apply online, you have all of your required documents, such as transcripts, ready to upload as PDF files. BCIT.ca/admission will guide you through the step-by-step application process. Once you are ready to apply, you can visit bcit.ca/apply, and the application fee for domestic students is $90. Here we have some key dates. We offer 3 intakes per year with 96 seats available per intake. Within an application period, the date you apply does not have an impact on your application. You do have until the deadline date to apply, but please do not wait until the last day. Here are the academic entrance requirements. Note that there are high school level requirements as well as post-secondary ones. For the high school requirements, for English 12, there are testing and course options available. Both foundations and pre-calculus 11 and 12 are accepted towards the math requirement, but with differing grade requirements. For chemistry, chemistry 12 can be used in place of chemistry 11. Post-secondary subject areas are accepted in place of high school level requirements, and out-of-province or international courses may also be accepted. Now, upgrading options are available to those who do not meet the high school level requirements, and please do contact us in program advising for assistance on navigating the upgrading options. Now, the academic foundations, that is all at the post-secondary level, and they can be completed at BCIT or another post-secondary. If you choose to complete them at another post-secondary, please refer to the PDFs on the nursing entrance requirements page for the acceptable equivalents and the general education criteria. Now, note that final grades for the academic foundations are required by the application deadline. And for those with international education, an ICES evaluation may be required if you choose to use your international post-secondary courses to meet the academic foundations requirements. So on to the non-academic requirement, that's the mandatory applicant questionnaire. Please type right into the form. Don't cut and paste from another document. The formatting doesn't come through. So do type right into the form. And also note that the boxes on the form can't be expanded. So you have to be very thoughtful, clear, and concise on your responses. Now, admission to the program is competitive. And on this form, the selection committee is looking for relevant experience. It does not have to be health related. It can be customer service experience, like serving experience, etc. What they really want to see is your people care and your interactions. They're also interested in leadership and teaching skills and evidence that you can work with all types of people from different backgrounds and ages. As mentioned, your application is completed entirely online, so you'll need to upload all of your documents to your application. You can download official digital transcripts, or you can convert your transcripts and documents to PDF files by either scanning or taking pictures and then saving them as PDFs. But please ensure you upload all required documents to minimize any sort of delays in application processing. Now, here's what happens after you apply. Your application will be reviewed by the admissions department to verify that you've fulfilled all the entrance requirements, and this process typically takes up to 4 weeks. If you meet the requirements, your application is then forwarded to the nursing department for further review, and the competitive assessment process occurs over about a 2-month period following the application deadline. The department uses a rubric to shortlist the strongest candidates, and final decisions are made based on everything that you've submitted. Now, if you have any questions or require any kind of clarification, please do not hesitate to contact Program Advising. So we can answer questions regarding entrance requirements, the application process, student resources, success strategies, program schedules, and more. Please visit bcit.ca/advising for the most current information on our services and service hours. Now, moving on from the academics, know that BCIT is committed to supporting students in a holistic sense. We want you to succeed not only in your academics, but also outside of school. Some student services are available to you as prospective students, while others will be available to you once you become an enrolled student. Here are some of the important student supports that I'd like to mention. If you are Indigenous, BCIT's Indigenous Initiatives Department is there for you to ensure a smooth transition into your first year. They offer peer-to-peer mentorship, a welcoming gathering place, and provide clarification on Indigenous funding. BCIT's awards, scholarships, and bursaries are listed on our financial aid and awards webpage. I would like to mention that we have a President's Entrance Award, for which selection is based on academic achievement and on volunteer and community service. If you have any questions about award scholarships or bursaries, please contact the Financial Aid and Awards Office directly. We are also committed to providing assistance to students with permanent and temporary disabilities. If you've been accepted into a program and believe you may need accommodation to be successful, I encourage you to connect with our Accessibility Services Department. We also have Student Health Services, which is a clinic located at the Burnaby campus. They provide medical care for current BCIT students all year round. We have counseling and student development. They're available to help you enhance your educational performance and maximize your success as a student at BCIT. And we also have recreation services. They promote, encourage, and enable the practice of physical well-being. We consider recreation an integral part of campus life and welcome all students to enjoy their services. Back to you, Erin.
Thank you, Babina. So I know we've been giving you a lot of information this evening, and you guys have been busy typing your questions into the Q&A, so I'm glad to see that all of those are getting answered. But I would really love it if you guys could keep in touch with us through the process of exploring your post-secondary options and the process of applying and getting accepted places. So BCIT Health Sciences are on social media. We're on Facebook, Twitter, X, Instagram, YouTube, TikTok, and LinkedIn, and our social media channels are a great way to kind of see what students are up to at BCIT, what student life is like, what's going on in each of our programs, new technologies, new developments. So it's just a really great way to kind of see what it would really be like to be a student with BCIT. And also to learn more about BCIT, we do offer campus tours year-round. We have a Spend a Day program. We have our twice annual Big Info event. We have numerous info sessions that have just been happening over the last week or two. We do these info sessions for our health sciences programs 3 times a year in February, March, May, June time, and October. So if there's other programs you want to learn about as well, please check out those as well. And as we talked about with Babina, program advising. They're going to be your best resource as you go forward preparing your application and if you have any questions about admissions. So now, questions and answers. I have been seeing so many great questions coming through the Q&A, so I really appreciate everybody asking your questions. I appreciate Yuki, Lorene, Babina, Vivian, and Lynn for answering questions. Jeanette has a good question that I'm going to answer live. Jeanette is asking if there is certain intakes that are less competitive compared to others. So Jeanette, as we all know, the most common time for people to begin school is September. So I'm going to say that September is probably the most competitive in a general year. I mean, it changes year from year, so I never 100%, but January and April are generally less competitive because people don't think about starting at school in January or April. So yes, if you're unsure of the strength of your application, you might want to consider that.
Erin, I've got a couple of questions that I
Yes.
can answer live. So one is, so if I have below a GPA below 3.0, will my application be disregarded? The answer is no, your application is not going to be disregarded. You just need to ensure that you meet the minimum entrance requirements. How competitive your application is will depend on the applicant pool. It's hard to say what that overall average is going to be. Historically speaking, having a 3.0 average is probably beneficial. But if you're slightly below a 3.0, don't be discouraged. Submit your application as long as you meet the minimum requirements. If you've done some post-secondary, that's great. Make sure you've got the experience in there and you answer the mandatory applicant questionnaire as thoroughly as you can. And then there was another question about the prerequisites, if they need to be within the last 5 years. Only requirement that has that requires recency is the university level anatomy and physiology. So that's the BHSC 1200, which has to be completed within 3 years of the intake that you're applying for.
Thank you. And I know Jill has one that she would like to answer live, which is quite the question from Samantha. Jill?
Yeah. Yeah, it's a great question, Samantha, because you do hear a lot in the media, and those of you that have family members that work in healthcare, it was definitely stressful over COVID, and there's still working on, because we lost a lot of nurses, the staffing ratio, the ratio from nurse to patient was difficult to maintain because of the shortages in the healthcare field. I do think that there is big changes on the way, and that the contract that was recently signed has mandatory staffing ratios in there of 4 patients to 1 nurse. So the ministry and the government are certainly looking at that and hoping to implement that. And to implement that, we need more nurses into the profession, and that's going to help bring down those ratios of patients to nurses. And I think that's really what the crux of some of the stress that's happening in healthcare is just the lack of nurses. So the more nurses that are entering the profession, the better it's going to be for everyone. And Veronica, if you have anything else to add to that, that would, yeah, feel free to jump in there as well.
I've noticed that a lot of my cohort has been, getting jobs like in the middle of our term. So a lot of us are not too worried about after the program, like where we're going to head off after the program. So there are quite a lot of areas that you can go into after the BSN program. So yes.
Erin, there's a question here that says, can you still be in the process of completing the prerequisites while applying to the nursing program? So I just want to address this, that you need to have a complete application. And so in order to have a complete application, you need to have final grades for the academic foundation. If we are accepting applications and you're still completing courses from the academic foundation, if you are going to have final grades before the application deadline or by the application deadline, then you can apply. But if you will not have final grades by the deadline, do not submit your application for that intake. Wait for the following intake.
Thank you, Bhavina. Yeah, I saw that somebody upvoted that question too, so I'm sure that's one that more than one person was wondering about. Jill, I saw that you had another question you wanted to answer live as well.
I did. I'm trying to find it.
It's Jake is asking if my GPA is not high enough, can I retake the courses 1 or 2 more times to get higher grades?
I'm going to let Yuki or Lorene or Lynn answer that. I was actually meaning to click on, someone had asked about if they can work in the program as in the healthcare, right, after completing one semester. So I wanted to answer that one live, because yes, you can work as an employed student nurse. It really varies based on the health authority posts the job for student nurses. The job might mean you have to have completed 3 terms, maybe 4 or 5 terms. It really is varied depending on the job they're looking for, but it's a great opportunity to make money and to get extra skills, is to work as an employed student nurse. You can also work as a healthcare aide, and Lorene probably knows when that is. If it's after, I think it's after term 2 that you can work as a care aide. So lots of opportunities to work in healthcare, yes, while you are in the program. And we used to say, please don't work when you're in the program, but now we're saying, we know you need to work when you're in the program, because how else can you afford to feed yourself and pay rent? So yes, we know that you're having to work. We are trying to consolidate classes so that they're on maybe 4 days, so that you have 1 day if you need to work and do other things to make sure you're maintaining your mental well-being. So yes, we certainly do have lots of students who work in the program.
Jill, would you like to comment on what the NCLEX pass rate is for BCIT? I know ours is quite high, but...
Yes, I believe it was 92% the last time that I looked. So we've fared quite well with the NCLEX pass rate.
Oh, Babina, you have one that you would like to answer live.
Yeah, so the question is, how do we know if the math and chemistry that was taken at a college or an international institution meets the high school math and chemistry requirement? Darren, if you could maybe put into the chat a link to the equivalencies page from the admissions site. So generally speaking, we do accept courses from international institutions, high schools, colleges. We do provide some resources that help you to self-assess if you've met the math and chemistry requirement. And I think that that link to the equivalencies webpage is going to be placed in the chat. Now, if you have specific questions and you need help navigating, please do connect with us in program advising, and we can help you find some of those answers.
You guys are asking very good questions. I'm just reading through some of the answers that have been given. Okay. Anything else, Jill, you'd like to share before we end off?
Yeah, I think someone had asked about attrition rates. So based on the amount of students that come into the program, how many do we actually graduate? And most nursing schools aim to have an attrition rate that's steady throughout the years, and ours has remained steady at about 5%, which is great. We're trying to keep, if you're applying to the program, we want to keep you in the program, which is why BCIT has a lot of supports in place for student success. In our program, we also have a dedicated student success lead for the nursing students, because we are really wanting to focus on helping our students succeed. And so that when you're starting the program, we want you to graduate from that program.
And there's a similar question to Jill that somebody has said, how do you support students if they fail an exam?
That's a really great question. So we have, we start out by doing exam reviews where you look at where you went wrong on the exam. We have a learning strategist that works with students to look at study techniques, note-taking, how to take multiple choice questions. We have a student success lead that can help with issues with groups of students on usually the thinking like a nurse piece. So we call that clinical decision-making or clinical reasoning. We also have open lab where students go in and practice their skills. So it's another great way for students to just really build up and maintain their skills to bounce back, because as Veronica said, that mindset of just being able to be resilient and pursue. And if you don't do well in an exam, then it's just learning from that and figuring out, okay, what can you do next time so that you can succeed? So that's a really great question.
Great. I have noticed a few questions of people asking for these dates again. We go back to here. So I'm just going to leave this up for a moment because I know there was some questions about what the dates were, and these are consistent dates year over year.
Can I speak? Can you hear me, Erin?
I can hear you. Your laptop works, Lorraine.
I know, thank goodness. Okay, so the September date is only for this time. It was an error. It should have said March 15th, but we are honoring September 28th. So normally, and I'm answering a question live, it says, why is the application opening and deadline so short for the January intake? It's not really. We usually only have our applications open for 6 weeks. And the reason for that is because what we have found over many, many years of doing this is that in the last 2 to 3 weeks is when we get more than 50% of our applications, regardless of how long they were open for. So we decided to go short, and it worked until the last couple of years, and that was probably due to COVID and changes in whether people were going to school or not. So we're just going to watch what we're doing now, and we might make changes in the future, but for now, these are the dates. And good luck on your applications.
Thank you, Lorraine. Oh, Abby's asking a good question that I'm going to answer. She says, if you decide on pursuing a specialty, can you take the further schooling at BCIT? And how much longer would this take? So yes, BCIT is well known for our specialty nursing program. So all of those different specialties that we have listed on the screen earlier in the presentation are available through BCIT Specialty Nursing. There are a few different options for completing them. So the timeline question is not something I can totally answer because there's a couple different options. There are definitely options to get parts of that or all of that paid for by your employer once you're working as a nurse. So that's something you can look into. But if you're interested in specialty, please do look at taking that after you graduate at BCIT, and you can go on the specialty nursing website for more information about that one. Jill, you have a question here. Yes.
Yeah, we've got someone asking a question about what GPA you need to continue in the program. And we go based on percentage. So the passing mark for our nursing courses is 65%, except for in the specialty nursing courses, which is it 75 or 70%? Lorraine probably knows, sorry, but it's 65% for our nursing courses in BSN.
Sorry, Jill, I missed what you were asking. Specialty nursing?
What's the passing percentage for specialty nursing? Is it 70 or 75?
It's 75.
Okay. Thank you.
Just for the 2 courses in specialty nursing. For everything else is 65.
Yuki's answering a question for me, but I do see somebody asking how I can get a recording of the video of this webinar. As I mentioned earlier on, this is recorded. So in about a week's time, everybody who registered for this info session will get a link to the recording and a copy of the slide deck, and that will be emailed to you at the email address you used to register for this session. So might go to your junk mail, you never know, so check there, but do wait about a week before you worry that you've missed it. Wow, lots of questions still coming in.
Hey, Erin.
Yes.
I would like to once again discuss the application open.
Yes.
And close dates.
Yes.
Are what you see on the screen, everybody, with the exception of the one at the bottom.
Sorry.
Oh, can you go back? With the exception of the one at the bottom, instead of it saying April 28th, it should say March 15th. And if you put March 15th instead of April 28th, those are the application deadlines that you see. And yes, we do realize that there are errors on our webpage. We aren't going to correct the error that says April 28th. That one will stand. We will honor applications up until April 28th. There's another error. It says September 15th. That is an error and it will be changed. It's in the process of being changed, but it's not done yet. It will be done. So check back for the application deadlines. Right now, we're more concerned with the April 28th deadline because that's the one that we're working for September. Okay, so I'm not going to answer any more questions about application deadlines. But good luck again with your applications.
Thank you, Lorraine. I know that. Okay, well, I think that I'm going to give Bavina just a moment to finish typing her answer, but I think we're going to end it off there. Now, I know you're going to have questions after this. You're going to think of other questions, or there's maybe questions in your mind that we did not get to. So in that case, please do email program_advising@BCIT with any of your questions. You can also go on Program Advising's website to see what other ways you can contact them. Simply Google BCIT Program Advising and you'll get right to their website with all of their contact information. So again, Program Advising is your best resource going forward as you prepare your application, as you make decisions about your nursing education. Please do keep in contact with them. And if they have any questions that they can't answer, they will come and talk to us in the nursing department and they will get answers for you. So you don't have to worry about that. Again, thank you all for joining us tonight. I can't believe how many wonderful questions we've had come through. You guys have definitely done some of your research and there's definitely some passion in the room for nursing, and we're really happy to see that. And we hope to see many of you on campus soon. Thank you.